Thank you, Las Corla, and I thank Minister Daly for being in the House this afternoon to answer my question here. I'm calling on the Minister for Health to urgently address the failings identified as part of a review of the paediatric audiology services provided in more than 900 cases by one audiologist in Mayo and Roscommon from 2011 to 2015, which may have left some children with lifelong impairments. I first of all want to congratulate RT Investigates for another outstanding piece of work and uncovering this situation. As we know now, the HSE carried out a review of services provided in Mayo and Roscommon from 2011 to 2015, and of the more than 900 cases examined, 49 children have been found to be affected. This is yet another unbelievable failure by the HSE, and it is absolutely staggering to think that this particular audiologist has been working in the Mayo Roscommon area for over a 10-year period. It is unforgivable that many of those children identified in the review of paediatric audiology services provided in Mayo and Roscommon from 2011 to 2015 may be left with lifelong hearing impairments. It is utterly shocking and an utter failure of the system. What good is the apology that has now been given to those families if their children had an increased risk of a misdiagnosis or may be left with lifelong hearing impairments? I also understand that the clinical team who undertook the review found that many of the hearing assessments did not meet national audiology standards. Time and time again, we are hearing of failures in the HSE, and I have to say it is extremely difficult for the public to have faith in the organisation. And that's a pity, because there are some things they do very well, and there are some excellent frontline staff. But Minister, you see it yourself. Time and time again, we see situations like this. If this review only covered the period of 2011 to 2015, what about the many other cases that this individual audiologist carried out if they were working in the Mayo Roscommon area for over 10 years? I would call on the Minister for Health, and I know you're here to represent him today, to clarify whether the review will now be extended to cover the full period of time the audiologist was working in Mayo Roscommon, and also whether the review will be extended to other parts of the country where this particular individual may also have worked. I have already submitted a number of parliamentary questions on this matter in a bid to seek urgent clarification in this latest unwelcome development. I have been contacted by a constituent whose daughter was misdiagnosed by the audiology service, and although she was told her child was not hearing impaired, her mother's instinct led her to paying for a private consultation. The child did indeed have a hearing impediment. The family then paid privately for an operation to deal with that problem. This family paid over €2,000 to have their child's hearing corrected and protected. Will this family get a refund, seeing as it was the HSE's failings that led them to get this private treatment?
Minister's 4 minutes.
And thank the Deputy for raising the issue. And these are important forums to have these issues raised, where the Deputy has a chance to represent the views of the people he has the honour of representing and bring their fears and concerns and get answers. And I suppose on the other side it gives an opportunity for the HSE to explain some of the background and put some of this in context, not by way of defending but by way of explaining the background to these. So concerns raised by the HSE Assistant Clinical Lead for Audiology Services in Mayo Roscommon arising from a routine review of services in 2015 led to a look-back of paediatric services provided between 2011 and 2015. The HSE has finalised a report of the look-back and shared it with the 49 families concerned on the 7th of June 2018. The look-back report represents a thorough analysis of the quality of service delivery in the area against standards for such services that were set out in the National Audiology Review Group report. Since 2011, the recommendations of this report, including clinical governance and quality assurance processes, have been the benchmark for the quality of service delivery throughout the country. The report and accompanying communication from the HSE includes a clear apology for the failures identified and for the anxiety that this has caused to families and those who may have been harmed. The HSE has invited parents of the children to meet with a senior manager and a senior audiologist to discuss the findings of this report and be updated on their child's care. Some have taken up this offer. The HSE has stated that all the families affected were informed that the audit was taking place and were verbally advised as to the reasons why. All 49 children who needed follow-up as a result of the look-back process are either currently receiving or have already received the appropriate care they need. The HSE is reviewing the employment history of the individual clinician who provided the service, and this is being expedited as quickly as possible in reference to your question, Deputy, there about his previous working arrangements. It is appropriate that our health service strives continually to improve the quality of the services it provides and promotes a culture of learning where shortcomings are identified. The priority of the Minister for Health in relation to the families and children who have been impacted by the findings of this look-back is that the HSE takes swift action, including the provision of appropriate care, and the Minister is satisfied that this has been done in this case. In addition, the HSE now has a clinical governance and a quality assurance process in place for its audiology services, including any contracted services. This is in line with the National Audiology Review Group previously referred to there in 2001. The recommendations made in the look-back report around policies, procedures, team-based approach, audits as part of clinical governance, care pathways, recording of client information and service-level agreements for external providers have been addressed and completed both at regional and national level. Outstanding recommendations, including the rollout of an audiology patient management system, are being progressed. Gormagat.
2 minutes.
Thank you. Look, Minister, while I welcome your response here today, it's not adequate, and I truly accept you will acknowledge that I'm saying that sincerely. And again, I want to point out you're here representing Minister Harris. Now, in part of your delivery to us here today, you talk about the swift action of the HSE. You're quite an intelligent man yourself. This has gone back 5 years, this review. We could be looking at cases going back 10 years of a failure within the system. Now, certainly, I would not call that swift action. And more serious here, if some of those people who have been reviewed now and had found out, 49 of them as we know, to have not been properly diagnosed, if they now are ending up with issues for life, would you not feel guilty? Would I not feel guilty? Should the HSE not feel guilty? Apologies are no good at this stage. I would, however, say that everybody that has been offered further assistance and help in meetings, they should take it up. And I'm sure most of them will. But again, this is a very serious matter. And it's more serious because it's gone back over 10 years. I repeat again, Minister, this review is for 5 years. We need to revisit this. The HSE need to revisit this, look at where this audiologist was working, maybe have an audit of the equipment. Maybe there are issues with equipment, I don't know. But we really have to stop this, where people have trust in the service and then they're let down by it. Now, I rest my case, and I thank you.
Ministers, 2 minutes to respond.
Thank you, and I note the sincerity and the passion of the Deputy across, and he's noted for the same in any of his presentations here in this chamber and any other fora I've had the pleasure of working with him on. I suppose just a couple of things to put in context. That in 2011 there was a national audiology group established, and one of their recommendations was that a national clinical lead be appointed. That was done. Subsequent to that recommendation, there was a national clinical lead for all audiology services. In 2015, that national clinical lead carried out a routine review, something that they do periodically, just review a whole series of cases. But there was concerns during that routine review that arose that led to this very specific look back then, which covered all the cases from 2011 to 2015. Your CHO was one of two CHOs that had external people because of the lack of available staffing To do the service within the HSE, there was 2 CHOs had to, if you like, outsource the expertise required in, and yours was one of those. It was a routine review, which is carried out periodically all the time in all the services, and you will have a situation where you have 110,000 people working in an organisation like the HSE, unless we robotise it in full and have robotic procedures carried out. There will always be error where there's human beings involved. It's a fact of life. It is important that the HSE continue to do all of these routine reviews, and any red flag whatsoever that the HSE do as they did in this case. And I'm not here to defend anybody, just explain as it is that they had a proper look back at the cases in 2011 to 2015 that identified, and these anomalies were raised. And as you know, there was 990-something children called back, 40-something, 45, I think, of those children were deemed to have issues arising. All of those children are either getting the care or have received the care that they need, or are getting it as we speak at this moment. Thank you.